with heart failure can be daunting. The disease presents a number of challenging symptoms, and it affects a person's quality of life, of course. To help people manage heart failure and find a way to live the life that they want, Carle Hospital is having an event, and it's a heart failure event. So cardiologist Dr. Shaik is joining us this morning to talk a little bit more about heart failure and the event. Good morning, doctor. How you doing?
Good morning. I'm doing well.
Good. Thanks for being here.
Sure.
So let's start with heart failure. What is it, and what do people need to be aware of?
Sure. Heart failure is a disease where the heart is not able to pump enough blood, and blood carries oxygen. And without that, patients can have symptoms of shortness of breath, fatigue, decreased energy levels, and also patient can experience some swelling in their feet, weight gain. So, yeah, heart failure is somewhere, patients have all the symptoms I described.
So what might be some of those risk factors that we need to be aware of before we have a diagnosis of heart failure?
So the most common risk factor for patients who develop heart failure is ischemic heart disease, which is nothing but blockages in the arteries of the heart. And for that, hypertension and diabetes, and then cholesterol problems, and some other kinds of heart failure also happens in patients who does drug abuses, cocaine, methamphetamines, alcohol, and then some people have genetic predisposition to develop heart failure.
And for people who are already getting treatment for heart failure, what can they do? Is there anything that they could do?
Absolutely. There are multiple, modes of treating heart failure. It's just not medications. It's also talking to them, how they're feeling, where they are. As I said, not only medications, we can do pacemakers, defibrillators, and then for patients who are not able to feel better with these treatments, then we can also treat them with something called artificial heart pumps and heart transplants.
Okay, so doctor, tell us about the event that's coming up that Carle is hosting.
Yeah, so on March 24th, Carle is going to host a heart failure community event dinner. So during that event, we make sure that all the community people are able to attend that, learn more about the heart failure. There we have a heart failure specialist, pelvic care doctor, a pharmacist, a nutritionist, you name it, we have everybody there who could talk to the patients, their families, to get over this problem, and how can we treat them in the long run.
Okay, and why is it so important to have an event like this for people who are experiencing heart failure?
It's very important because, when patients and families come to see us in the hospital or in the office, it's just 15 minutes, 20 minutes, or 30 minutes.
Right.
And this event is going to go on for 2 to 3 hours. They can open up with all the questions they have to ask us, and then it's an open forum, basically, for everybody.
Great. Is there registration information? Do we have to register for this event?
I think so, yes. We do have registration information, and then the best thing to, we'll have something up for you guys shortly, who to call and where to call. Otherwise, the best number to call would be call HVI at 217-904-7000.
Perfect. And if you want to register for that, it's carle.org/heartfailure.
Correct.
Okay.
Yes.
All right. Thanks so much, doctor, for being here this morning. We'll be right back.